Hello, welcome to the Triad Healthcare Network presentation on Myths and Facts, Statin Use in Persons with Diabetes. This is Dr. Beth Hodges. If you have diabetes and your doctor has recommended a statin drug, but you are reluctant to take it, this presentation is for you. Statin medications lower cholesterol, and some common ones are atorvastatin, previously marketed as Lipitor, simvastatin, better known as Zocor, pravastatin, which was known as Pravachol, rosuvastatin, which was Crestor, lovastatin, which was known as Lescol, and Livalo, for which no generic currently is marketed. All of these medications are inexpensive, with the exception of Livalo, which, as mentioned, does not have a generic equivalent. Fact: heart disease and stroke are the number 2 and the number 5 most common causes of death and disability in Americans over age 50, and number 1 and number 3 most common after age 65. Fact: statins have been shown to significantly reduce the chances of these events. When a statin drug prevents a first-time heart attack or first-time stroke, that's called primary prevention. They also prevent the chances of a second event, which is called secondary prevention. Fact: 50% of people who have their first cardiac event, such as a heart attack, do not survive. Fact: 90% of people who have their first heart attack or stroke had no idea it was about to happen. So waiting until it's needed is 2 years too late to start medication to prevent it. It takes 2 years of being on a statin medication to start shrinking blockages in arteries. There is a faster effect on blood vessels that statins do that involves decreasing inflammation and smoothing the interior linings of the vessel walls. That occurs faster. But to actually shrink pre-existing blockages takes 2 years. Fact: statins can cause birth defects and should not be used in women who may become pregnant if they're not taking measures to prevent pregnancy. Dr. Suzanne Steinbaum, cardiologist and spokesperson for the American Heart Association, had this to say: 80% of the time, heart disease is preventable with early intervention. It is the biggest health factor under your control. Now let's talk about some myths. Myth: statins cause dementia or memory loss. The fact is, studies of 23,000 patients showed a 29% long-term reduction in the diagnosis of new-onset dementia. Myth: statins cause muscle damage. The fact is 1 in 20 patients, which is 5%, started on the very highest dose of a statin available will have some muscle pains, still meaning that 95% of patients who are started on statins do not. These pains are usually caused by a deficiency of a nutrient called CoQ10 and can be combated or prevented by taking 200 to 750 milligrams of CoQ10 supplement daily, or by switching to a different statin. Rosuvastatin and pravastatin are metabolized differently than other statins and are less likely to cause this side effect to begin with. Now, there is a serious muscle issue that can be caused very rarely in statin use called rhabdomyolysis. If you have suffered from rhabdomyolysis confirmed with laboratory testing, you need to talk to your provider about whether attempting statin use again would be safe for you. But this is a very rare event. Myth: statins cause liver failure. Fact: this event is so rare that the FDA no longer lists it in the labeling for statins, and liver function is no longer required for patients on statins. Myth: statins cause diabetes. Fact: in an analysis of 91,000 patients on statins, there was one new case of diabetes in every 255 patients. The patients affected were noted in the 4 years of the study to have gained weight, usually around the waistline, and that's a separate factor for the onset of diabetes. The percentage of cardiovascular events estimated to have been prevented in this population dwarfed this finding. Myth: statins increase the risk of stroke. Fact: the Sparkle study looked at atorvastatin versus placebo or sugar pill in 4,731 patients who had already had one stroke. The risk of a second ischemic stroke was dramatically reduced in the atorvastatin arm, but not in the sugar pill arm. The risk of a second hemorrhagic or bleeding stroke went from 2.3% in the atorvastatin arm up from 1.4% in the placebo arm, so an increase of less than 1%. Now, to put this in perspective, only 3% of all strokes are hemorrhagic in nature. 97% of strokes are ischemic. So there was a definite decrease in ischemic strokes with use of statins and a minimal increase in hemorrhagic strokes, which are rare to begin with. Myth: if your cholesterol is not high, you don't need a statin. The fact is, for a diabetic, the risk of heart attack or stroke is already high, regardless of your baseline cholesterol. In other words, the numbers don't matter. You could have a very good-looking cholesterol by the numbers, but you're still at high risk for a heart attack or stroke if you have diabetes, even if that diabetes is well controlled. Taking a statin significantly lowers this risk. Myth: a statin always has to be taken daily. Fact: for a diabetic who has not yet had a heart attack or stroke, significant reduction in these events occurs with taking a statin, even if taking a low dose just a few days each week, which is called intermittent dosing. Is intermittent dosing right for you? This is a conversation you need to have with your provider. Talk to your doctor and get the facts. Thank you for listening. This has been a presentation by Dr. Beth Hodges of the Triad Healthcare Network. Have a nice day.